Ferchie, we're ready for you now. It's completely okay to feel nervous. You are not alone in this. Let's take it one step at a time. I'll be with you through every part of this process, okay?
Fergie, thank you for coming in today. We have received the results of your tests, and unfortunately, you've tested positive for HIV.
How is that possible? I thought I was careful.
I know this is a lot to take in. HIV doesn't always show symptoms, and sometimes people can live with it for years without knowing. But we have effective treatments now, and it's manageable if we act quickly. We'll walk you through everything.
But how? How did I get it? What should I have done differently? So I can be cured?
Unfortunately, there's no cure yet. But the good news is, with proper treatment, people with HIV can live long, healthy lives and prevent passing the virus to others.
And we'll be here to help you manage it. You are not alone in this. We have so many resources available, and together we'll make sure you get care you need.
What about my mom? I could have possibly passed it to her.
We'll get him tested as well, just to be safe. And once you start treatment, your viral load can become undetectable, meaning you won't transmit the virus to anyone else. That's called undetectable is equals to untransmittable.
Okay, next. Okay, scene 3 na tayo. Scene 3 na. I feel so ashamed. I don't want anyone to know.
It's completely okay to feel nervous. You are not alone in this. Let's take it one step at a time. I'll be with you through every part of this process, okay?
Hey Fergie, how are you and what did the doctor say about your condition?
Oh my god, about that, I am HIV positive. I was really scared when I first found out. I didn't know who to turn to. But now I know that I'm not alone. I'm on medication now. And I'm learning more about how to protect myself and my family.
Your viral load is undetectable, Fergie. This is great news. Keep up with your treatment and continue using protection.
Thank you, Dr. Tiffany. I feel like I can breathe again.
We've learned so much and we're stronger than we ever are before. Thank you. I'm so proud of you, Fergie. You've been handling this so well.
Thanks, Dad. I know it's not easy, but it's getting better. And now I'm talking openly about it. I want other people to know that HIV is manageable and testing is key. And now I also want to help others learn about the prevention and treatment for it.
As long as we keep supporting each other, we'll get through this.
Yes, thank you, Dad.
So to add for health education in HIV, it is a virus that attacks cells that help the body fight infection that makes a person more vulnerable to other infections and diseases, in which the body can get rid of HIV and no effective cure for it exists. It means it is uncurable. So how does HIV spread? It spreads through certain body fluids from a person who has HIV. That could happen by having unprotected vaginal or anal sex with a person who has HIV. Unprotected means not using condoms or medicine to treat or prevent HIV, in which it is a common way that it spreads from person to person. It is also spreading by sharing drug needles through contact with the blood of a person with HIV from mother to baby during pregnancy, childbirth, or breastfeeding. So the signs and symptoms for acute and chronic HIV, in which we have two types, is fever, joint pain, skin rash, sore throat, swollen lymph nodes. And for the acute or chronic, so for the chronic one, we have fever, fatigue, diarrhea, weight loss, oral thrush, shingles, and persistent generalized lymphadenopathy. So the diagnostics we do for HIV is antibody test that searches for antibodies to HIV in your blood or oral fluid. Antibody tests utilize blood from a vein that can detect HIV sooner than tests done with blood from a finger stick or with oral fluid. It also looks for both HIV antibodies and antigens. That involves drawing blood from the vein. Lastly, a nucleic acid test looks for the actual veins in the blood, in which a healthcare provider will draw from your vein and send the sample to a lab for testing. So, we have a clinical staging for HIV, in which we call primary HIV infection, that consists of patients who are asymptomatic or those with symptoms of acute retroviral syndrome. Stage 1 consists of patients who are asymptomatic or do not have any symptoms at all, and it's non-contagious. Stage 2 is patients who have unexplained weight loss or moderate degree less than 10% of body weight. That is recurrent respiratory tract infections, herpes zoster exacerbations, which is mild to moderate severity. That leads to angular cheilitis, recurrent oral ulcerations, papillopruritic eruptions, and seborrheic dermatitis or fungal nail infections of the fingers. Stage 3 for those people who have severe weight loss, unexplained chronic diarrhea, persistent fever, oral candidiasis, oral hairy leukoplakia, pulmonary tuberculosis, and severe invasive bacterial infections, namely pneumonia, empyema, osteomyelitis, meningitis, and bacteremia. Acute necrotizing ulcerative stomatitis, gingivitis, or periodontitis, and unexplained anemia, neutropenia, or thrombocytopenia for more than 1 month. For stage 4 patients, they develop HIV wasting syndrome and pneumocystis, pneumonia, chronic herpes simplex infection, esophageal candidiasis, extrapulmonary tuberculosis, Kaposi sarcoma, toxoplasmosis, HIV encephalopathy, extrapulmonary cryptococcis infections, and other infections that may cause a person to get ill. So as stated, the pharmacological management for HIV is that it is incurable, but could be managed with medications or therapy that is called antiretroviral therapy or ART. ART can make HIV infection a manageable chronic condition that reduces the risk of spreading virus to other people. Other pharmacological management available for the treatment of HIV include nucleotide reverse transcriptase inhibitors (NRTIs), non-nucleoside reverse transcriptase inhibitors (NRTIs), protease inhibitors, integrase strand transfer inhibitors. The other drug classes we have is CCR5 antagonists, fusion inhibitors, attachment inhibitors, capsid inhibitors, and post-attachment inhibitors that are reserved for patients with multi-drug resistant HIV infections. So we also have the nursing management for HIV is to provide comfort for the client, in which we inform them about their condition and help them comprehend it, that complications can essentially be minimized with proper treatment and therapy, and provide its risk of transmission if HIV is viral and remains elevated or worsens, and emphasize undetectable or untransmittable to motivate patient adherence. Monitor for signs of infection, laboratory tests that indicate infection. Provide education regarding the risk of resistance if medication non-adherence occurs. We should also ensure adequate nutrition and hydration to mitigate the effects of HIV wasting syndrome. and monitor weight loss and educate the patient regarding lifestyle changes that can be used to mitigate weight gain associated with antiretroviral therapy that is used for treating HIV or minimizing its symptoms. We should also encourage our clients to stay active and assist in planning daily routines that maintain activity to optimize their function and maintain their healthy balance. And provide counseling to help the patient maintain social support. To conclude, HIV education is important because it helps prevent the spread of HIV and makes people aware of the signs, symptoms, and nursing management, pharmacological management of this condition that promotes a better health results for members of the society, community. Also, an advocate program should be provided to increase awareness about its transmission, prevention, and treatment that is called antiretroviral therapy, which is called ART, to foster an environment of empathy, compassion, understanding of this disease that helps empowers individuals with the accurate sources that leads for a better overall health. Also, that includes adherence to treatment for those also living with this condition. To conclude, sustained health education contributes to reducing new infections of this disease, improves overall quality of life, and it helps us move closer to the goal of ending the HIV epidemic slowly, gradually, and all over the world.